Children's health issues, abrasions, cuts, and scratches. Sometimes abrasions, cuts and scratches result in dire consequences if they aren't taken care of at the right time. Children run around the house and drop vases and other glass material, which can result in scratches or cuts. Outdoor activities should be supervised carefully, otherwise abrasions caused by a wall or a rock is unavoidable. There are slight differences among the three, and most of the time children get them while playing. Cuts are caused by sharp objects, which can penetrate into the skin or damage the skin on the surface. Scratches are a mild form of cuts. They are also caused by sharp objects such as a piece of glass, thorn, or a knife. Even fingernails can cause a scar. Abrasion is caused by friction or rubbing of the skin with a rough surface. Rug burns and board burns are also examples of abrasion, because they are caused by friction. Also, in all three cases, the wound can bleed. It bleeds when the tiny blood vessels located underneath the skin gets ruptured. Platelets form clot to stop the bleeding, and a scab can also form, which should be pulled out as that will interfere with the healing process of the body. If the bleeding isn't stopping, the wound should be covered with a soft cloth. After that, the wound should be cleaned using lukewarm water and mild soap. Antibacterial ointment should be used to clean the wound, and it should be covered with a bandage. The antibacterial ointment helps kill germs. The bandage will prevent bacteria from getting within and prevent the wound from getting bothersome. But the bandage should be changed every day and the wound should be kept dry. The good thing is that abrasion, cuts and scratches don't require any special attention in most cases. But if the scratch is made by animal claws or abrasion is caused by a rusty metallic surface, a doctor should be approached immediately, because the animal could have rabies and the rust can cause septic. Depending on the situation, the doctor would prescribe antibiotics, lotion, or even shots. It is also a good idea that parents make sure that their kid is given tetanus shot on a regular basis. Sometimes, the wound won't be caused in dangerous circumstances, but because of negligence, the wound will get infected by bacteria. If the wound is infected, it will show symptoms such as redness, swollen skin, and production of pus, which can be of the color yellow or either green. Cuts can sometimes be too deep and even long. In such cases, stitches should be certainly opted for. It is a very simple procedure. The area of the wound is made numb using some kind of anesthesia. It can either be injected or simply applied directly. Then the doctor will sew the cut edges together using certain needle and thread. If the cut isn't big enough, the cut is sealed using a special kind of glue, instead of the stitches. The glue will hold the edges together so that the skin underneath will heal, and over a period of time, the glue will dissolve. Kids need to check with the doctor every week, so that the doctor will be able to analyze the improvement. And when the wound is completely healed, the stitches are cut open using scissors.